Hi, my name is Gabrielle Lujan, and today I'll be presenting on biofeedback as an adjunct for substance use treatment. Substance abuse is defined by the United States Department of Health and Human Services as the use of alcohol or drugs in a manner, situation, amount, or frequency that could cause harm to the user or to those around them. In addition, the Diagnostic and Statistical Manual sets forth criteria for diagnosing mental illness, including substance use disorder. Their criteria include at least 2 signs or symptoms of drug abuse in the past 12 months, things such as withdrawal, tolerance, psychosocial problems, significant time spent using, and cravings. Drug use is very prevalent in the United States. 27.1 million people in the U.S. abused illicit or prescription drugs in 2015. In 2014, over 47,000 deaths were due to drug overdose. It is now the leading cause of accidental death in the United States and is a chronic illness and public health crisis, as it costs the United States over $400 billion annually in physical and mental health care costs, crime, violence, motor vehicle accidents, child abuse, neglect, and death. Healthy People 2020 establishes several goals for substance use, including increasing the number of people who need and receive specialty treatment. Part of the problem is that withdrawal symptoms occur during periods of abstinence, typically endured by people undergoing treatment. The withdrawal symptoms are both emotional and physical and can be very uncomfortable. And treatment includes prolonged abstinence as a goal, which means going without the substance and experiencing those withdrawal symptoms. This leads withdrawal to be one of the biggest reasons people relapse. So in order to be effective, substance use treatment must be comprehensive, must include increased access to care, early interventions, evidence-based treatments, and integrated care. Biofeedback training is a mind-body technique that's used to control involuntary biological responses just by your thoughts. It can influence blood pressure, pain, body temperature, heart rate, respiratory rate, and more. It's non-invasive, and it has been proven effective for treating anxiety, stress disorders, pain disorders, headaches, GI problems, and more. Many of the things it's used to treat successfully include side effects of withdrawal symptoms. Several studies have been done examining the effects of biofeedback on substance use disorders. Degani Irani, Rostami, and Nadali 2013 performed a randomized control trial looking at the effects of biofeedback on psychological distress and substance craving. The experimental group received 30 50-minute biofeedback sessions over 2 months' time, plus a medication regimen, while the control group received medication alone. And their results showed significant improvement in overall psychological status for the experimental biofeedback group, and significant reduction in substance cravings, including a desire to use and relief from withdrawal. Rostami and Degani Irani 2015 also examined the effects of biofeedback on addiction severity, mental health, and quality of life. They looked at 100 crystal methamphetamine-dependent men aged 17 to 50, and the experimental group also received 30 50-minute biofeedback sessions over 2 months' time, plus medication, where the control received medication only. Their results showed significant reduction in addiction severity for the biofeedback group, significant improvement in mental health status, and significant improvement in quality of life. The strengths of these studies include that their randomized controlled trials had distinct inclusion and exclusion criteria, low attrition rates, reliable measures, strong statistical analysis, and positive outcomes with no significant decompensation for participants in either the control or the experimental group. Weaknesses include a small sample size, no female participants in either study, short-term treatment times, and placebo effect possibilities in the form of patient motivation or excitement. Primary care advanced practice nurses might be in an ideal position to treat substance use disorder, as addiction is a chronic illness and often experiences other comorbidities, including underlying mental illness and chronic pain. It can even lead to or exacerbate things such as hepatitis, HIV, liver cirrhosis, and the withdrawals that we talked about. And because they would have an established patient-provider relationship, they're in a perfect position for enhanced assessments, early interventions, and referrals to treatment. The advanced practice nurse could use biofeedback as an adjunct treatment for substance use disorder because it is individualized, integrated, addresses needs holistically, is evidence-based, addresses those important withdrawal symptoms we talked about, and can require collaboration from other providers, support services, or organizations. A referral to biofeedback training is supported as an adjunct treatment because it has shown significant improvement in overall health status, reduction in addiction severity, and there's really a lack of observed negative outcomes and side effects in the literature. It can be part of a comprehensive plan of care by increasing the number of people receiving treatment, improving the health status for patients with substance use disorder, and allowing the advanced practice nurse to work to overcome this public health crisis related to drugs. Thank you.